AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
Good morning, everyone. Welcome to AAMG channel. Today, we're honored to have our specialist from AAMG. His name is Dr. Wenwu Jin. Good morning, Dr. Jin.
Good morning. How are you?
Very good. So Dr. Jin has been practicing in the San Francisco Bay Area for many years, and he is currently practicing in the San Francisco Bay Area. He's part of the Golden Gate Urology Group, which is the largest urology group in the San Francisco Bay Area. His office conveniently located in Chinatown, and he sees his patients in a variety of hospitals in the Bay Area. Welcome, Dr. Jin. And today we would like to talk to the audience about prostate health. And Dr. Jin, were you able to briefly explain why this topic is so important to our audience?
Okay, Esther, thank you for the introduction. Yeah, I've been practicing Bay Area since 2009. So mainly I work in San Francisco, among the hospitals in the city. The prostate health is very important for all men, basically, because when men getting older, everybody, feel the effect in one way or the other. And also the good thing about prostate health, if you catch it early, we have the best results. So today I want to talk to you about how to identify those problems and how to manage them.
Sounds great. So,
okay.
Welcome.
All right. So the topic today is about prostate health. So how does prostate work, and what is a prostate? The prostate is a part of a male reproductive system. The prostate main job is to produce fluid for semen. The other part of the semen is produced by seminal vesicles, which is also next to the prostate. The prostate is about the size of a walnut and weighs about an ounce or so. It sits right below the bladder and in front of the rectum. It goes around the urethra, and the urethra carries the urine from bladder and then out through the penis. I'm going to show you in a picture in a minute. So this is the male urinary system. You can see the kidney on the top. Kidney is where the urine is produced. That flow down along the ureters, go into the bladder. Then when you're ready to pee, the bladder pushes the urine out of the urethra. You can look at the prostate right at the junction of the urethra and the bladder. So this is another picture, close up of the picture using the prostate right at the base of the bladder and the urethra here. So there are a few common diseases for the prostate. One, probably everybody heard of, it's called benign prostatic hyperplasia, simply BPH. The next important disease is the prostate cancer. The third common one is called prostatitis, which is basically an inflammation of the prostate. But that's kind of acute disease. When it's treated, it's gone. So today we are not going to talk too much about prostatitis. We are mainly focused on the first two things. One is the BPH, and the second, the prostate cancer. So let's talk about the BPH first. BPH is when the prostate and the surrounding tissue expands. As men getting older, the prostate will continue to grow. BPH is when the prostate gets large enough to cause urinary problems. As a prostate enlarges, it squeezes the urethra. So it may cause many of the lower urinary tract symptoms. So this is a diagram to show how it works. On the left side is a normal prostate. You can see the bladder is normal and healthy, and then the prostate is wrapped around the urethra, and then the urethra is wide open in the middle. But when men getting older, the prostate enlarges, and it compress on the urethra, make the urethra very narrow, so it obstructs the urine flow. As you showed here, on the left side is a normal prostate. When you empty the bladder, most of the urine can empty out pretty easily. But on the right side, you can see as the prostate enlarges, it causes obstruction. So when you urinate, most people are unable to completely empty the bladder. So these are the symptoms of the BPH. Most people can feel some incomplete emptying, or feel frequency, feel intermittent stream or slow stream, urgency, the weak stream, the straining, you have to wait, you have to push to urinate, and also nocturia, means you wake up more than twice at night after you sleep to go to urinate. So who gets BPH? Because every man has a prostate. So for men over age of 50, the risk of BPH goes up, because when you're getting older, the prostate will also getting bigger. And there's also a family history for BPH. So if your father had a BPH, you're likely to develop BPH too. The other things for men who are overweight or obese, or you don't do enough physical activity too. Some men with erectile dysfunction has more likely to develop BPH. So how do you make the diagnosis? Usually, the first thing we ask a patient to do is ask them to fill out the questionnaire to see what kind of symptoms you have with the urination. Then after that, when you come to see a doctor, the doctor can do some physical exam. One thing we do is called digital rectal exam. We put our finger into the rectum to directly feel the prostate. And we will also do some urine tests to see if any other abnormalities. And on top of that, we can do further some ultrasound or some other scans to further evaluate the prostate. The last thing we'll talk about is a blood test. There's a protein produced by the prostate, which is called Prostatic-Specific Antigen, simply PSA. We'll talk about this a little bit later. So if you got diagnosis of BPH, there are a few things we can do. For mild BPH patients, we can simply just do surveillance. We just monitor your diet and the food intake, some physical activities. Your symptom tends to get better that way. If that doesn't help, we can prescribe some medications to help you urinate. If a medication doesn't help, then we can ultimately go to surgery to fix the problem. So this is the active surveillance is best for men with mild to moderate symptoms. It's also an option for men who are not bothered by BPH. That means you have the problem, but you're okay with it. You probably don't need any treatment at this point. BPH is monitored with a regular visit. Most commonly we do yearly exam. If they got a symptom getting worse, we can do more frequent visit. The diet and the exercise are often, recommend to make some modifications to help manage the symptoms. The next step will be some prescription drugs. The main stream for treating BPH is alpha blockers. Alpha blocker is to relax the muscle of the prostate and around the urethra, so make the obstruction less, so the urine will flow better. Okay. The next class of medication is called 5-alpha reductase inhibitors. This class of medication they can shrink the prostate and also increase the urine flow. You know, if a single medication doesn't help, we can still use a combined therapy. We use multiple drugs to increase the efficacy of the medical treatment. There's some anecdotal evidence for herbal therapy, but in general, this is not recommended as a scientific approach because there's no solid evidence to support their efficacy. You know, most common one, people used a saw palmetto before, probably won't hurt. How effective is that? We don't know for sure. So this slide shows the alpha blockers, the main treatment medication for BPH. So currently, there are a few medications available. They are listed here: the afoxosin, doxazosin, prazosin, terazosin, silodosin, and the tamsulosin. Okay, these medications works to relax the muscle of the prostate and the bladder, but they do not shrink the prostate. They don't affect the size of the prostate, and also they don't affect the growth of the prostate. The main thing, they relax the muscle around the urethra to improve the urine flow, and it works very fast. It works right away. After you're taking for a couple of days, you can see the effect. The main side effect of this class of medication, including dizziness, lightheadedness, fatigue, and the difficulty ejaculating. So these are the medications for the class medication of 5 alpha reductase inhibitors. Mainly there are 2 medications. One is a finasteride, and the second is a dutasteride. The brand name for finasteride is a Proscar, and the dutasteride, the brand name for it is Everdart. Both are work pretty well to shrink the prostate and to slow down the prostate growth over time. There's mild side effect associated with the medications, mainly erectile dysfunction and the lower libido. If a medication treatment fails, next step to consider is through surgery. There are multiple options can be used from minor to major. You know, if it's just for temporary or minor procedures, we can do some catheterization. This includes Foley catheter, you know, put a catheter through the urethra, or we can make a small incision in the lower abdomen to make a opening directly into the bladder from abdomen. Then you can put a catheter through that opening. There's some mild, minor office procedures can be performed. The newer surgical approach include urolift, that's the prostatic urethra lift, and also resume, which is use water vapor to ablate the prostate tissue with the thermal energy. The next step, the surgeries are done in the operating room because you need some major anesthesia to control the pain. One is use a laser. We call it photoselective vaporization of the prostate, briefly PVP. The traditional approach is a TURP, called a transurethral resection of the prostate. That's still the mainstay, mainstream to treat the prostate enlargement. Lastly is the open surgery to take the prostate out. It's a simple prostatectomy. Next aspect of the prostate health we're going to talk about is a prostate cancer. Prostate cancer is the most common internal malignancy in US men. Prostate cancer is the second leading cause of a cancer death in the United States among men. Also is the 6th leading cause of death after heart disease, stroke, lung cancer, COPD, and accidents in the United States. So what is prostate cancer? Prostate cancer is when abnormal cells in the prostate grow out of control. The prostate cancer cells can form a tumor in the prostate glands and spread by breaking away from the tumor. Prostate cancer cells can travel through blood vessels or lymph vessels to reach other part of the body. Cancer cells may also attach to other organs and the tissues and grow to form new tumors there. This is a little bit more stats for prostate cancer. 1 in 7 to 9 men will be diagnosed with prostate cancer in his lifetime. In African American, there are 1 in 5 men whose fathers or brothers were diagnosed will also be diagnosed. There's a significant family history factor here. Currently, there will be 164,000 men diagnosed with prostate cancer this year. And over 29,000 will die from prostate cancer yearly. Currently, nearly 3 million men are survivors living with their lives after prostate cancer diagnosis. So this diagram shows the prostate cancer. It will start as a tumor growth in the prostate glands. So what are the symptoms and the signs of the prostate cancer? Prostate cancer grows in the glands itself. The early stage, it may cause no symptoms. So patient probably don't feel it at all. At intermediate stage, the prostate cancer may cause urinary symptoms such as trouble urinating or slow flow, causing frequent urination, causing pain or burning. At late stage, high risk stages, it may cause dull pain in the pelvic area, and they cause blood in the urine, and a painful ejaculation. It causes pain in the bones, and the loss of appetite, and the weight loss. So how do we find out the prostate cancer problem? The first thing to do is a screening. The prostate cancer screening means testing for a disease even before you have symptoms. Generally, screening is recommended for men with no symptoms who are between ages 55 to 69. For some men with higher risk for prostate cancer, should consider screening as early as age 40 to 45. What are the screening tests for prostate cancer? Number 1 is a digital rectal exam. We call it DRE. And the second is a blood test to detect the prostate-specific antigen. We call PSA. The definitive diagnostic test is prostate biopsy. So this diagram shows how digital rectal exam is performed. The surgeon uses a gloved finger, lubricated, and go through the anus and the rectum, so you can feel the posterior surface of the prostate. If you feel a nodule that's suspicious for a tumor, you should go for additional tests. The other test is called PSA, prostate-specific antigen. The PSA is a protein produced by the prostate. PSA is normally found in low concentrations in the blood. PSA naturally increases with age. So high PSA level in the blood test increase the risk of having prostate cancer. So in general, we set a threshold to trigger a prostate biopsy given the PSA levels. Most commonly, we use 4 nanogram per ml as a cutoff to trigger a biopsy. But recently, a lot of doctors using lower threshold to start biopsy. That means if your PSA higher than 2.5 or 3, you should be considering having a biopsy. So this is how prostate biopsy performed. Prostate biopsy is an office procedure. We use some local anesthesia to decrease the pain. And then we use the ultrasound probe to guide the needle go into the prostate. So use a biopsy needle, we take off some specimen, then send to pathology. They take a look under the microscope to see if they can find some cancer cells. So this is diaphragm for the prostate. We take biopsies in the different areas of the prostate. Usually we do 12 biopsies throughout the prostate. Then we'll see if they're the prostate. Once the prostate cancer is diagnosed with a biopsy, then we have to decide how bad the prostate cancer is. So there's a grading and a staging for the prostate cancer. The grading just means it's a measure of how bad the cancer cells are and how quickly the cancer cells are likely to grow or spread. The most common system we use is called the Gleason grading system. So once you get a diagnosis of prostate cancer, usually you are assigned a Gleason score that will tell the doctor how bad the cancer is. The second term is called a staging. The tumor stage is to describe where the cancer is within the prostate, how extensive it is, and if it has spread to other part of the body. So that just is how widespread the cancer is. The higher stage, of course, the worse. So if the cancer is still localized in the prostate, there's a lot of good treatments to cure them. So these are the list of the options for localized prostate cancer. The first one is surveillance. Because prostate cancer is a very slow-growing cancer, not all patients need treatment right away. The second one is called surgery. Surgery mainly including two options. One is robotic-assisted laparoscopic prostatectomy. That's a newer surgery approach with minimally invasive technique to take the prostate out. Traditionally, we use open radical prostatectomy to remove the entire prostate. Then the next option is radiation. There are two types of radiation available. One is called external beam radiation. That just use some X-ray to irradiate the prostate to kill the cancer cells. The second ways to apply radiation is through internal radiation, commonly called brachytherapy. That's what the doctors put a radioactive seed implanted in the prostate. So the radioactive seed can apply the X-ray to kill the prostate on site. There's some additional treatments for localized prostate cancer, including cryotherapy, which is a freezing treatment, and also high intensity focused ultrasound, HIFU. You use the ultrasound to treat the prostate cancer. If the cancer already spread, to other part of the body outside the prostate, just by removing the prostate itself won't cure the prostate cancer. So in that situation, you need some systemic treatment for the prostate cancer. The first choice to treat widespread prostate cancer is called hormone therapy. Prostate cancer is stimulated by male hormone. So by getting rid of all the male hormone, we can slow down the growth of the prostate cancer. If male hormone stop, if you hormone ablation, usually you work for a few years, then it will stop working well. In that situation, there's some newer drugs developed. We can add on the hormone therapy to slow down the progression of the prostate cancer. There are also immunotherapy. We can use some medication to stimulate your own immune system to fight the cancer cells. And then lastly, if all this failed, there's still chemotherapy. Use some chemoactive agents to kill the cancer cells. So for prostate cancer, because the characteristic of prostate cancer very slow growing and is presented at different stages and at different grades when the patient first diagnosis. So the treatment is very individualized. The patient and need to know the pros and cons for each treatment option and have a team oriented approach. Urologists usually the first one to make the diagnosis, and the other healthcare providers, including primary care doctor, your other specialties, including oncology or cardiologist, for example, and also your family and friends should be included in the discussion. Then after all this information were presented, we need to make a short-term and long-term plan to best treat the prostate cancer. So in one word, prostate health is very important for all men. And if we detect it early, we can have the best results. So talk to your doctor if there's any concern. Okay, thank you for participating. Thank you.
Thank you, Dr. Jin, for a wonderful presentation. I'm sure our audience will benefit for your presentation. If you like this video is also available on our AAMG YouTube channel. Please like and subscribe our YouTube channel so you always get the latest news. Thank you. So, done.
Thank you.